Picture this. You wake up, head to the bathroom cabinet, and pop a couple of pills you've been taking for years. Maybe it's something for joint pain, or stomach acid, or even bone health. You don't think twice about it. Why would you? Your doctor recommended it. The packaging looks safe. Millions of people take the same thing every single day. But what if I told you that some of the most trusted, most widely used medications in the world are silently doing damage to the one organ you absolutely cannot afford to lose, your heart? In the next few minutes, I'm going to walk you through 5 everyday medications that carry hidden cardiovascular risks that most people have never been warned about. We're going to talk about common painkillers, stomach acid blockers, cold and flu remedies, a class of older antidepressants, and something as innocent sounding as a calcium supplement. And here's the thing. The goal is not to frighten you or tell you to throw everything in your medicine cabinet into the trash. The goal is to give you the kind of clear, straightforward information that puts you back in the driver's seat of your own health. By the time this video ends, you'll know exactly what to watch out for, what questions to ask your doctor, and what steps you can take right now to protect your heart for the long road ahead. Before we get into it, if you find this kind of content valuable, honest, science-based health information without any fluff, go ahead and hit that subscribe button right now and tap the bell icon so you never miss a video like this one. This channel is dedicated to bringing you the health knowledge you actually need, and subscribing takes just 1 second. Let's get into it. Let's start with one of the most consumed categories of medication on the planet, non-steroidal anti-inflammatory drugs, better known as NSAIDs. You've used them. Almost everyone has. We're talking about ibuprofen, naproxen, and diclofenac, the go-to solutions for headaches, sore backs, joint inflammation, and general aches and pains. They work fast, they're effective, and you can pick them up at any pharmacy without a prescription. For most people, occasional use isn't going to cause a crisis. But here's where the story gets complicated. When these medications are used regularly, day after day, week after week, especially in people over the age of 60, the cardiovascular risks become very real and very significant. This isn't a fringe opinion or an internet rumor. Back in 2005, the FDA required pharmaceutical companies to add explicit warnings about increased risks of heart attack and stroke directly to these medications. Yet despite that, millions of people continue using them daily, like they're harmless vitamins. So what exactly is happening inside your body? NSAIDs work by blocking certain enzymes that trigger inflammation. That's the helpful part. But in doing so, they also interfere with substances that regulate fluid balance in your kidneys and the health of your blood vessels. 2 dangerous things happen as a result. First, your body begins to retain extra salt and water. Think about your heart like a pump designed to handle a specific workload. When excess fluid suddenly builds up in your circulatory system, that pump has to work much harder. A heart that's already dealing with the natural stiffening that comes with age, or one that's managing mild high blood pressure, may not be equipped to handle that extra burden. The result can be heart failure, not a heart attack, but a state where the heart simply cannot keep up with the body's demands. That's when people start experiencing swollen ankles, breathlessness, and extreme fatigue. Second, NSAIDs cause blood vessels to tighten. This directly raises your blood pressure. Even people who have never had hypertension in their lives can see their numbers climb with consistent use. And for those who are already on blood pressure medications, NSAIDs can make those drugs significantly less effective, essentially canceling out the protection they were providing. The risk is not equal across all NSAIDs. Diclofenac and high doses of ibuprofen, particularly around 2,400 milligrams per day, are most strongly associated with cardiovascular complications. Lower doses of naproxen seem to carry somewhat less risk, though no level of use is entirely without it. And there's one more thing worth knowing. If you take low-dose aspirin to protect your heart, Taking ibuprofen at the same time can block aspirin's protective mechanism entirely. So, what do you do if you're in genuine pain? You talk to your doctor. You ask specifically, given my age, my blood pressure, and my heart health, what is the safest way to manage this pain? In some situations, acetaminophen is a reasonable alternative. Topical anti-inflammatory gels or creams that work directly at the site of pain without circulating through the entire bloodstream can also be highly effective. And if an oral NSAID is truly the best option for your situation, the guiding principle is simple: the lowest effective dose for the shortest possible time. Now let's move to number 4 on our list, and this one genuinely catches people off guard, because these medications are actually marketed as being protective. We're talking about proton pump inhibitors, or PPIs. Omeprazole, pantoprazole, lansoprazole. These are among the most prescribed drugs in the world. Millions of people take them daily to manage acid reflux, GERD, or to protect the stomach lining when taking medications like the NSAIDs we just discussed. They're extremely good at what they do. The problem is what happens when they're used far beyond their intended window. PPIs were originally designed for short-term use, typically 4 to 8 weeks, but over time, they've become something people take indefinitely, often without ever revisiting whether they still need them, and that's where the hidden risks begin to surface. Here's the key issue: your stomach acid, while uncomfortable when it's causing reflux, actually plays an essential role in absorbing certain nutrients, magnesium being one of the most critical. When stomach acid is consistently suppressed over months or years, the body's ability to absorb magnesium is significantly impaired. This might not sound like a major concern until you understand what magnesium does for your heart. Magnesium is essential for maintaining the electrical stability of the heart. It regulates the signals that control your heartbeat. When magnesium levels drop, the heart's rhythm can become erratic and unpredictable. This is known as an arrhythmia, and depending on the type, it can range from mildly uncomfortable to genuinely life-threatening. Long-term PPI users who have never had heart rhythm problems in their lives have been found to develop arrhythmias rooted in magnesium deficiency, a deficiency caused directly by the medication they were taking to help their digestion. Beyond magnesium, some large observational studies have identified a statistical association between long-term PPI use and an elevated risk of heart attacks. One possible explanation is that PPIs may reduce levels of nitric oxide, a compound that keeps blood vessel walls relaxed and flexible. When nitric oxide is diminished, blood vessels stiffen and the risk of a cardiac event increases. It's important to note that this association hasn't been definitively proven to be a direct cause and effect relationship, but it's significant enough that researchers and cardiologists are taking it seriously. There's also a specific drug interaction that's particularly concerning. Omeprazole is known to interfere with clopidogrel, a blood-thinning medication commonly prescribed to people who have already had a heart attack or had a stent placed. The interaction can reduce clopidogrel's effectiveness by a meaningful amount, leaving these high-risk patients with less protection than they think they have. The takeaway is not to stop your medication without guidance. It's to have a real conversation with your physician about whether you still need it, whether the dose can be reduced, and whether your magnesium levels are being monitored. Many people who've been on PPIs for years could potentially manage their symptoms through dietary changes, eating habits, or other interventions, but they've never been given that conversation. Moving on to number 3, and this is one that affects virtually every household: oral decongestants. The ones containing pseudoephedrine or phenylephrine. Cold season rolls around, your nose is completely blocked, you feel miserable, and you grab something from the pharmacy shelf that promises fast relief. And it works. The congestion clears. You can breathe again. But what's happening in the rest of your body while your nasal passages are opening up? Pseudoephedrine and phenylephrine are vasoconstrictors. That means their mechanism of action is to tighten blood vessels and reduce swelling. In the nasal tissue, This brings relief. But these compounds don't stay confined to one area. They travel throughout your entire circulatory system and tighten blood vessels everywhere. For someone who is young and cardiovascularly healthy, the body can typically handle this temporary effect without incident. But for someone over 60, someone with high blood pressure, heart disease, or any existing cardiovascular vulnerability, the consequences can be severe. As blood vessels tighten throughout the body, the heart is forced to pump against significantly greater resistance. Blood pressure can spike sharply and suddenly. At the same time, these drugs act as stimulants on the cardiovascular system, causing the heart to beat faster and sometimes to beat irregularly. An already stressed or vulnerable heart pushed into this state can develop a dangerous arrhythmia. European health authorities have raised fresh concerns in recent years, specifically about pseudoephedrine and its association with rare but serious conditions involving reduced blood flow in the brain. These aren't theoretical risks. They've shown up in real patients who took over-the-counter cold remedies without a second thought. The particularly dangerous aspect of this category is accessibility. Because these products are available without a prescription, and because we associate them with harmless cold relief, people rarely stop to consider whether they're appropriate for their specific health situation. Labels are glanced at briefly and then set aside. If you're over 60, and especially if you have any history of high blood pressure or heart problems, these medications deserve serious caution. Before reaching for one, speak with a pharmacist or your doctor. Saline nasal sprays, humidifiers, and corticosteroid nasal sprays that act only locally can provide relief without putting your heart under pressure. Let's talk about number 2, and this is a topic that requires both sensitivity and directness. Mental health medications, specifically an older class of antidepressants known as tricyclic antidepressants. Medications in this category include amitriptyline and imipramine. It's absolutely crucial to acknowledge that depression is itself a significant risk factor for cardiovascular disease, and treating it is not optional. It's necessary. But the way it's treated matters enormously, and certain older medications carry cardiovascular risks that simply aren't acceptable when safer options now exist. Tricyclic antidepressants, while effective, affect the heart in several ways. They can cause orthostatic hypotension, a sudden drop in blood pressure when a person stands up. For an older adult, this can mean dizziness, loss of balance, and dangerous falls. Falls in elderly individuals frequently lead to fractures, hospitalizations, and a cascade of complications that can seriously affect long-term health. Beyond that, these medications increase the resting heart rate, placing ongoing strain on the heart over time. Most concerning of all is their effect on the heart's electrical system. Tricyclics can slow down the signals that regulate the heartbeat, producing abnormalities that show up on an electrocardiogram and significantly increase the risk of ventricular arrhythmias, dangerous, fast, and sometimes fatal rhythms originating in the lower chambers of the heart. Because of these well-documented risks, tricyclic antidepressants are no longer considered appropriate first-line treatment for depression in older adults. Modern antidepressants, including SSRIs and SNRIs, have much safer cardiovascular profiles. However, tricyclics are still occasionally prescribed for managing neuropathic pain, which is why people may end up taking them without fully understanding the cardiac implications. If you or someone close to you is currently taking one of these medications, please make time to discuss it with a physician. Ask whether safer alternatives have been fully explored, and ensure that heart rhythm and blood pressure are being properly monitored throughout treatment. Your mental health and your heart health are not in opposition. Both can be protected simultaneously with the right approach. Now we arrive at number 1, and I want to be upfront. This is the most debated and perhaps the most surprising item on this list, because it involves something almost universally considered to be beneficial. We're talking about calcium supplements, the very pills that generations of people have been told to take for strong bones, particularly to prevent or manage osteoporosis. For decades, the message was consistent and simple. Calcium builds strong bones. Take your supplement, protect yourself. That advice came from a genuine place of concern. Osteoporosis is a serious condition that leads to fractures and significantly reduced quality of life, and calcium is genuinely essential to bone health. The controversy is not about calcium as a nutrient. It's about the specific way concentrated supplements deliver it to your body. When you consume calcium through food, dairy products, leafy greens, fortified foods, it enters your bloodstream gradually. Your body absorbs what it needs in a measured, natural way. But when you swallow a calcium supplement tablet, it creates a sudden, concentrated spike in blood calcium levels. Your body cannot immediately direct all of that calcium toward bone formation, so the excess remains circulating in the bloodstream. The concern, supported by a growing body of research, is that this excess calcium may deposit along the inner walls of arteries, a process called arterial calcification. Arterial calcification stiffens blood vessels, reduces their flexibility, and contributes to the formation of plaques, the same plaques that are implicated in heart attacks. Several large-scale studies have found a modest but statistically meaningful association between calcium supplement use and elevated cardiovascular risk. Other studies have not found the same association, and the scientific community continues to debate the evidence. But the pattern has been consistent enough that many cardiologists are now recommending that their patients prioritize dietary calcium over supplemental calcium whenever possible. If you have been diagnosed with osteoporosis and your doctor has determined that supplementation is necessary, that conversation is worth having again with cardiovascular risk as part of the equation. It should never be a decision made without medical guidance, and more is definitely not better. Taking more calcium than is actually needed for bone protection does not provide additional benefit and may introduce additional risk. We've covered a lot of ground today. 5 medications that most people would consider routine: anti-inflammatory pain relievers, acid-blocking stomach medications, common decongestants, older antidepressants, and calcium supplements, all of which carry risks to your heart that are frequently overlooked or never discussed. And I want to be absolutely clear about what this information is not. It is not a reason to stop your medications without talking to your doctor. Stopping certain medications abruptly can itself be dangerous, sometimes more dangerous than continuing them. What this information is meant to do is give you the awareness and the language to have a better, more informed conversation with your healthcare provider. The next time you walk into that office, go in prepared. Bring a complete list of everything you're taking: prescriptions, over-the-counter products, supplements, vitamins, everything. Ask specific questions. Ask whether a medication you've been taking long-term is still the most appropriate option given your current cardiovascular health. Ask whether alternatives exist. Ask whether certain blood markers, magnesium levels, blood pressure trends, heart rhythm, should be monitored given what you're taking. Every treatment involves a balance between the benefit it provides and the risk it carries. That balance is not static. It shifts as you age, as your health situation evolves, and as better options become available. Being an active participant in your own healthcare, armed with genuine knowledge, is one of the most powerful things you can do for your long-term health. Before we wrap up, I want to hear from you. Drop a comment below and let me know. Did anything in today's video surprise you? Have you or someone you know experienced an unexpected reaction to one of these medications? Your experience and perspective matter, and they may be exactly what someone else needs to hear. Also, I'd love to know what topic you want me to cover next. Leave your suggestions in the comments. Your ideas genuinely shape the direction of this channel, and if you haven't already, please make sure to subscribe and tap the bell icon so you're notified every time we put out a new video. This channel exists to give you honest, clear, evidence-informed health content that helps you make better decisions for yourself and the people you care about. Subscribing is the best way to stay connected to that. Take care of your heart, take care of yourself, and I'll see you in the next video.